right? And can you speak a little bit more about how you do join the poses together with the anatomy teachings? How does that work?
Like for the joints and the muscles, it's not very easy, but it's kind of easy because it's also it's logic, but not everything that logic really works. You know, there are some muscles, for example, who do some functions in some joints, and sometimes we use those muscles. Sometimes we try to not use those muscles to get a specific effect. So for like muscles, joints, and bones, and like the whole thing of the yoga asana anatomy. For something, it's for me, it's quite easy because also Iyengar yoga is so specific. So with other yoga directions who don't have such a specific technique, it's very difficult to explain what's going on. With Iyengar yoga, we describe the movements, what we have to do very precisely. And so also we can like connect it to the anatomy, which is also kind of very precisely.
Do you find that those always match up? So the asana instruction that we would give in Iyengar yoga matches up with the correct anatomical work?
Yes and no. So for something, it's I think because Iyengar yoga is so specific, and we also use a lot of anatomical boards, the trapezius, the quadriceps, the name of the bones, the different directions. For this, I think it can be very useful, or the anatomy can explain those things. But on the other side, since we feel something, and feeling something is not the same as like if you look from outside. So the inside view is totally different. It's not totally different, but it's different to the outside view. And this is sometimes very confusing. For example, sometimes we say, make the dorsal spine concave, or make the shoulder blade even concave. You know, a bone is a bone. You cannot make it concave.
Right.
But we want to create the feeling as if the dorsal spine is concave, or the shoulder, the scapula is concave. So we give some inner pictures to create an action with some movements that might not be anatomically correct. And this, I think it's like, for me, sometimes anatomy and yoga is like two different kind of languages. And what I'm doing, I try to translate, because sometimes it can be confusing. If you don't have a good anatomical background, I think you might not have a problem to make the dorsal spine really concave, or to make the shoulder blades concave. You just do it, which is sometimes very helpful. You just do it, you feel it, everything is perfect. But if you know that you cannot make a bone really concave, maybe you might be stuck. You think, no, it's not possible, and you lose the connection to your body. And then I want to, sometimes in the courses, then I can explain it. It's a picture. And with this picture, anatomically, like those things, those other things are happening, but maybe not making a bone concave.
Right. And there's sort of an art to the practice where as you said, the instructions are to create a feeling in ourselves or an action in ourselves, which may not exactly align with the science, and they still have their purpose. Would you say they still can make sense in terms of the practice?
I think the words we use in Iyengar yoga, they are fantastic, because they lead us within our body perfectly, and they do not have to be anatomically correct. They have to come to an effect what we want to. But on the other side, since we are so precise, so I think somehow it's good to know when do we use words to create an effect, but we use not anatomically correct words to create an healthy effect. I don't know whether, I hope this is not too confusing.
Yes,
Um,
it makes sense. Yes. And so if we get an anatomical background or we have the correct understanding of the anatomy, that can enhance our work even if the instruction doesn't exactly align with anatomical correctness. We sort of have these two layers of understanding going on at the same time.
I think as a yoga practitioner in the beginning, maybe it's good not to have any anatomical background because you just follow what the teacher is saying and you're like you just experience what's going on within your body. But at least when you, for example, when you start teaching, you really should either experience and you have to use your experience, but somehow you also want to explain something. And I think the more when it comes to teaching, I think it really you should have a basic anatomical background, especially when the students are asking you questions who have some anatomical background and they know, oh, the teacher also has it, then the students believe you more. Or when it comes to therapy or when it comes to to yoga therapy, I think you really should have some anatomical background. Otherwise, it gets a little bit difficult or dangerous if you don't have it.
So on that note, can you explain a little bit about how this background knowledge can help us both with therapeutic applications? So we'll talk about, for example, common ailments, and also injury prevention. I think those are two topics where, Iyengar yoga practitioners are quite keen to develop, this aspect of practice and know that they're working correctly, whether they have an existing issue or whether they're looking to make sure, okay, I am doing this pose in the correct alignment and this is giving me the maximum benefit.
For example, a joint. Yeah, if we look at a joint, it's good to know if we talk about knee joint, hip joint, etc., that we know what a joint is made of. And one specific thing of a joint is the joint cartilage. So when we are young, the joint cartilage is thick. If we get older, it gets thinner. And then with cartilage, I think it's good to know that this kind of tissue needs pressure and depressure, or another word for depressure. So pressure and less pressure, pressure and less pressure, and the joint needs movement for staying healthy. So and I think it's good to know if you understand that if I move or if I give some pressure on a joint or if I release the pressure, that is good for the health of the joint cartilage. And or another example is the discs which we have in our spine. They are also kind of cartilage. So if we don't move our spine, the cartilage gets or let's put it the other way around. Also, the cartilage or the intervertebral disc of our spine needs compression and decompression. Then they stay healthy. And but if there's a problem, for example, if you have a disc problem or a disc prolapse, then compression might, for a specific period of time, compression might increase the problem. But to heal, and then we have to see, for example, cartilage can heal very slowly. But it's important to know that joint cartilage can heal and also the intervertebral discs can heal. This is a very important information. Sometimes people say cartilage cannot heal, but it can heal, but it can be healed very slowly. So if there is any irritation in either joint cartilage or in the discs, you need specific, not movements, but you need specific decompressions that it can heal. And then slowly you can increase the pressure and when the joint cartilage has healed or the disc has healed. So it's good to know what kind of tissue is within our body when there is like an irritation, how long does the recovery needs, and what kind of movements or not movements is needed.
Yeah, so at different stages, we require different poses, different actions. Yes. Okay, and are you working at your center now? Do you work one-on-one with therapeutic scenarios with people?
Yeah, we started with a therapy class or medical class as they do in Pune, like a lot of patients with different problems, but there's one person who is taking care of the person. They have specific sequences. And right now we have specific classes for, we have a knee class, we have a neck and shoulder class, we have a low back class, we have a hip class. We have a class for multiple sclerosis. So all those teachers are trained, especially in those problems. Maybe they have them. And so the people come there. And then we have also the classes like in Pune for problems who are more complicated. Then they really get a very individual specific sequence. So the last actually 30 years, we have evolved slowly those different kind of classes and which are very nice and interesting, especially if they help the people.